Welcome back to Mission in Motion, A Minute with Maxwell. In part one, we explored the national landscape of healthcare leadership with the president and CEO of the Canadian College of Health Leaders, Sue Owen. From leadership development to workforce challenges and the evolving capabilities required for today's leaders.
How do we manage the different generations in the workplace? I think it's really challenging to find that line of best fit that says, okay, I'm going to meet Gen Z as well as, the baby boomers, because there are still some. And I think that's really challenging. And I don't know, I don't off the top of my head, obviously, I don't know how to crack that, but I think that that's really critically important.
In this second part of our conversation, we shift into a more candid and forward-looking discussion.
Looking after your people is really important. And when we ask leaders from across the country what keeps you up at night, many leaders say making sure that we're looking after our people and putting our people first. And how do we do that?
Exploring what isn't always said out loud, what's at stake if we don't evolve, and what leadership will truly require in the years ahead. Let's dive back in. I'm Heather Maxwell, and I would love for you to join A Minute with Maxwell, Mission in Motion. So welcome back, Sue.
Thank you.
So we are going to dive back in and we're going to talk a little bit about your personal leadership reflection. Can you tell us what has been one of the most defining leadership lessons in your career?
Oh, wow. I mean, there's so many. I think one of the things that as I've gotten older is, like leadership humility is really critically important. I think that, as you're starting out and, you want to have an upward trajectory. I think a lot of young people feel that they need to be that go-to person and the person with all the answers. And part of that's true. Certainly, if you want to distinguish yourself in a sea of hundreds of really bright, smart people, you do need to really make yourself that go-to person. But as I've gotten older, and particularly in this role, I think leadership humility is really critically important. Is that it's important for a leader to have vision and to understand where he or she or they are going, but also looking after your people is really important. And, when we ask leaders from across the country what keeps you up at night, many leaders say making sure that we're looking after our people. And putting our people first. And how do we do that? And if you think about, particularly from a financial perspective, how do you ensure that salaries keep pace with, the cost of living? How do you make sure that we're creating safe spaces physically and psychologically for our staff when we're really in a dynamic environment? And no one leader, and this is not anything novel, no one leader has all the answers. And so I think the spirit of humility, I think is really critically important. And that spirit of listening, I think that's, no one teaches you these things in MBA. Like no one says you've got to listen a lot more. And because certainly there's an inertia of wanting to move forward. I think the second thing that's really important is that no one has, or very few people have this linear upward trajectory. Mm-hmm. You and I could find examples of people that went from coordinator to manager, the director, VP, and CEO. And certainly we see those people out there.
Yeah.
For average people like myself, you don't find this linear trajectory. You go from one role and maybe to another lateral role. Maybe you take a step back. And then, it's almost like nothing you ask for, but everything you hope for. Mm-hmm. And certainly in my role, I've heard from people to say, the best thing that happened to me was to lose my job because it forced me to reevaluate where I was going. Mm-hmm. And I think that self-reflection in concert with humility is really, really important. In my volunteer role, I'm the chair of the board of Swimming Canada. And so I was a swimmer. It's an amazing passion project. And if you think about it, like high performance athletes have coaches. They're surrounded by communities of people who are focused on helping them succeed.
Yeah.
And that, Olympic gold medalists will train hours and hours and hours to shave 1 or 2 tenths off their time.
Yes.
I don't think we do that for leaders. At least, again, nothing is taught to us. I think it happens with very, very sophisticated people who are very self-aware. And I think that part of that self-awareness comes to the point of like where you're able to make decisions and understand where your blind spots are. So I work with a coach. A lot of leaders do. And the thing is, we all have blind spots, and I wouldn't be aware of them if I didn't have those blind spots. I think having perspective is really important. Having time to reflect is really important, and
Yes.
taking the time to reflect as well. And certainly in my experience, many leaders feel the same way.
Yes.
And sometimes we get to that point the hard way, those
Yes.
hard lessons learned. But if you think about, self-reflection, humility, um, surrounding ourselves with people that know more than we do, being
Yeah.
open to the opinions of others, and being okay with saying, I actually don't know the answer to that, or you know what, this is a problem. How do we co-create the solution?
Yeah.
I think is really critically important. And again, these aren't things that are necessarily taught. Again, we're taught to be like, I've got the answer, and I'm going to feed you the answer and move forward. But I think those are some of my perspectives.
I love that, Sue. I love that because I so agree with you. I just think humility is one of those traits that's underestimated, actually. And it's so important to, as you said, surround yourself with good people and not be afraid to ask the important questions or admit when you don't know something, right?
Yes,
I think that
yes.
is such a great trait in every leader, in any leader. So I love that you said that. And, we just talked about, that lesson that you've learned in your leadership journey. But what keeps you up at night that isn't captured in reports, data, or public discourse? What would you say keeps you up at night?
Yeah, I think it's probably consistent with what I'm hearing from some of my colleagues is that how do I look after my people? How do I make sure that I'm like, for me, it's a little different because I'm running a national association. So I've got 25 people, 26 people that are expecting me to show up every day and be consistent.
Yeah.
And I don't always feel consistent. Sometimes I'm tired. Sometimes I'm, maybe not feeling my best, or I travel quite a bit. So I'm
Mhm.
in different time zones.
Yeah.
And so I do find it doesn't keep me up, but I do find I'm focused on how do I show up in a consistent way,
Yes.
in an accessible way. I think it's important.
Yeah.
And then what keeps me up, not necessarily in a bad way, but it's like, how do I make sure that the college is a relevant organization? So
Yeah.
I joined the college because it was a place that I could rub elbows with senior leaders. I had access to decision makers.
Yeah.
It was an exciting proposition. I remember I was working at the Canadian Red Cross Society and went to the head of the Red Cross at the time, Alan Prowse, and said, I want to join the college. Can you help me? And he was very, very supportive, and I'm grateful to this day. And I want other people to feel motivated like that. I want them to go, when you're a coordinator, hat in hand to your senior leader and say, I want to join the college.
Yes.
And what keeps me up is like, how do I get to that place where it's the must belong to organization?
Hmm.
When I only have a team of 25, and how do I make sure that our systems internally are keeping place? How do I modernize the learning and leadership development programs in a way that it keeps
Yeah.
pace? And I was just saying to one of our chapters is that the college is the Canadian College of Health Leaders. We should be the exemplar
Hmm.
of leadership and leadership development. And so how do I
Hmm.
bring everybody along to
Hmm.
that? So
Hmm.
I tend to sleep really well, but when I'm on my own, when I'm driving, and as I said, I travel quite a bit. These are the things that are, the constant
Percolating.
conversations I'm having with
Percolating. That's
myself.
right.
Yeah, yeah,
That's right. And I think every good leader thinks like that. Am I doing the best thing for my people? Right? Are they engaged? Are they safe in their roles? Are they engaged in their roles? Are they enjoying their roles? I think that keeps, or that's certainly top of mind, I think, for most good leaders. So I appreciate that you said that. It is all about our people, right? It really is. And so, in that vein, Sue, do you feel that we are doing enough to support leaders? Or are we sometimes setting them up to operate in unsustainable conditions?
I think both. I think that I think the challenge is not, are we doing enough, or, are we burning people out? I think the reality is that organizations have a finite amount of capacity.
Yeah.
And I think that depending on the day of the week or the time of year, the needs of keeping the lights on and keeping care provided to patients and their residents and their families, I think that is all consuming.
Yeah.
And so I think the challenge is because, like, if you think about during flu season, or if you think about if there's a natural disaster, if you think about you're doing construction or you're moving into an electronic health record, that just consumes so much bandwidth. And I think that there isn't one organization that isn't focused on looking after its people and making sure that they're developing its people. I think the amount of bandwidth they have to dedicate to that is greater or lesser depending on the environment in which that organization is working. And I think it's the demands of the environment. I think that it's, the pace of change is changing. I think the environment's changing. I think that the way healthcare practitioners practice is changing. And so that is time consuming. But I think if you interviewed every single leader coast to coast, they would say, I want to invest in my people because I want my people to bring their best selves to work. And I don't want them to feel overwhelmed.
Yeah. Yep. That is so true. And I just had actually an interview with Dr. Rebecca Greenberg the other day, and she also said that moral distress is actually a workplace hazard in healthcare,
Yes.
especially, right? Where we know that moral distress is, perhaps when you are doing something, but you feel that perhaps you're not doing it to your best because you want to do your best. However, you feel like you're not doing your best because you're either constrained by resources or time limits or something like that. So you want to do your best work. However, you're not always sort of doing your best work because it's so, there's such time limits sometimes and resources are limited. And so that moral distress piece is actually what is burning a lot of people out in healthcare. What would you say about that, Sue?
Yeah, and there's a lot of literature that speaks of moral distress being the byproduct of being empathetic. Yeah. And so if you think of it, again, no one goes into healthcare to say, I prefer to be unempathetic or I prefer not to be relational. But I think that there's just the churn in healthcare is so much that people want to do a good job. They want to be empathetic. They want to provide great relational care. And they can't because of resource or time constraints. Yeah. And I think that moral distress comes when people are going over and above. There's a lot of literature that suggests in long-term care in particular that personal support workers will actually go in on their days off or stay beyond their shifts so that they can do relational things like, there's one article I read that the PSWs will do the hair and nails of the residents and live in long-term care homes. Mm-hmm. And it's those individuals that want to be empathetic, that want to be caring. They get that moral because they don't feel that they're doing enough.
Mm-hmm, mm-hmm. Yeah. And this is always a challenge, I think, across our sector, right? We do, I think everyone works in the healthcare sector under limited resources, time constraints, all of those things are impactful on the staff, the staff that we have, right? That everyone has across our sector. So that I think is really key in for leaders to look at that and keep that in mind as well, right? This podcast is brought to you by Maxwell Management Group. For nearly 2 decades, we've worked side by side with individuals, teams, and organizations to uncover what makes them exceptional and to help them grow from the inside out. It's not just about reaching goals, it's about creating success that feels deeply authentic and genuinely meaningful. Organizations, like people, have stories. And when those stories are rooted in purpose, they become powerful forces for attraction, culture, and identity. We are committed to partnering with brands that want to lead with intention, cultivate vibrant workplace cultures, and become the kind of employer that top talent seeks out, not because of perks, but because of purpose. I've had the privilege of leading Maxwell Management Group's growth into a highly specialized national executive search and education firm, one that thrives on values, vision, and the belief that when people lead with purpose, extraordinary things happen. To find out more about our executive search, recruitment, and education services, please visit us at maxwellmanagementgroup.com. So, the evolving leadership capability model, Sue, the demands on healthcare leaders, as we know and as we've been talking about, have shifted dramatically. What capabilities are now non-negotiable that may not have been a decade ago?
Yeah, that's a hard question to answer. I would say that what we've learned, without giving away too much in terms of the leads refresh, is that for us, the domain, in our perspective, the college's perspective, is that the domains of leadership, which is lead self, engage others, achieve results, develop coalitions, and system transformation, that's unchanged. Like, that's evergreening.
Yeah.
What that sits on top of, those capabilities, what we've learned in our leads refresh is there's probably 3 or 4 things that I would call out that we haven't really seen before. One of the things that was really interesting to me, and it made complete sense, but I hadn't thought of before, is that this notion of reflexivity is that I'm going to pause and reflect, and I'm going to be in this mode of, CQI, and always be sort of recalibrating what I'm doing. We heard in the refresh that reflexivity is something that's really critically important. I think that, 15 years ago, we talked about equity was a place to start. I think EDI is it's much more than that now in terms of some of the capabilities. I think it's the ability to work with a wide variety of populations and people in a way that is nimble and consistent. And so if you think of the demands of a very increasingly diverse population, where English is not the first language, where their ways of working, their cultural norms. I think that, if you think about some of the parts of Ontario where there is huge immigration, being able to adopt the capabilities of dealing with those populations, so that, again, we're providing culturally competent care. I think that is something that it's much larger than it would have been 15 years ago. That's I think true. that in the best possible way, I think truth and reconciliation is much more visible than it was 15 years ago. So like 15 years ago, we wouldn't have seen things like land acknowledgements and what land acknowledgements mean to us, and speaking openly about, what the actual recommendations, the calls to action. I think a lot of organizations are taking that. And if you think about how that translates into the capabilities that we have as leaders, is that we always need to be in this, in a more rapid uptake of knowledge translation. So, again, we understand intuitively truth and reconciliation, but organizations now need to know what those calls to action are. They need to understand what the needs of an LGBTQ2S+ environment, or they need to understand the needs of they need to understand, first of all, who their patient or resident populations are, so that they can adjust that. So I think leaders need to be in this constantly evolving state of knowledge transfer and knowledge uptake in order to be nimble and meet the needs of those populations.
Yes, and that's why I like what you said about the communities of practice. right? Because I feel like leaders need to come together and support each other. Because to your point, there are just so many things to think about and to consider when they're making decisions. And that communities of practice, I think, is so key to have that ability to talk to your peers and talk about best practices and what has worked and maybe what has not worked, right?
Well, and we should be always in this mode of recalibrating. And I'll
Yeah.
share one of my experiences. As I was saying, I worked in Western Canada 4 years ago, and I had taken the Sanyas, like Indigenous cultural safety training, and I didn't think it was one and done, but I felt that I had a good foundation going into this work.
Mm-hmm.
And I had the privilege of working with an Indigenous liaison team who gave me their feedback, and that was a gift. And to
Mm,
be constantly in the state of receiving feedback is really important, because it's not like, oh, I've taken this course and now I know what to do. We
yeah.
need to be surrounded by people who are going to put up a mirror to us and give us that gift of feedback, and so that we are able to recalibrate, so that that fosters the sense of we're bringing our best selves to our roles.
That is a gift to get that feedback. Absolutely. Agreed. Wow, that was great that you had that opportunity, Sue.
Mm-hmm.
So, how should leaders be thinking differently then about, we touched on this a little bit earlier, about leading the 5 generations in the workforce now. And, I was doing research on this because we just spoke on this topic not too long ago. And I was actually amazed to find out that there are 200,000 people across Canada still working that are traditionalists. So generally
Yes.
80 and over, there's 200,000 people still working across Canada at that age. And then we have people as young as 14, 15 coming into the workforce. So we're, leaders are having to manage, 15-year-olds to 80 plus year olds. And that is quite significant because this is the first time in history this has really happened.
And if you think about ways of working, it's funny. We were telling our kids, like back when we were, in our 20s, if you wanted to go out on a Saturday night or Saturday afternoon, you had to start organizing on a Wednesday, because
Yeah.
it took, and people already had like rotary dial phones, and you had a phone and you had to pick up the phone and say hello, and,
Yeah.
take messages, and people called you back, and you had the one phone. And so this whole like relational organizing for someone who's in their 80s is very different than if you're in your 20s, that it's
Yeah.
all, there's a bit of like 1 degree removed, because you don't actually have to phone a person.
Yeah.
You can text them, you can email them, you can DM them. Like there's a whole ways of working. And so the nexus of that for leaders is really this notion of something to teach and something to learn.
Mm-hmm.
And as how do you actually co-create the future, in the sense that, if you have a problem you need to solve, you need to bring everyone together. But you need to actually start from this place of seek to understand. Where is it you're
Yeah.
coming from? And I
Yeah.
think the real challenge, Heather, is that we're so busy in the workforce,
Yeah.
we don't necessarily always have time to pause and say, okay, so now we're bringing together this group of nurses, and we've got the
Yeah.
22-year-old new grad, and someone who loves it, who's 73 and loves it so much that doesn't want to retire. Can you understand your ways of working? Because the
Yeah.
question becomes, where do you start?
Yes.
And I think that's part of the problem. And what we've noticed when the college has done the certified health executive with organizations, and we've put those individuals together with a single focus on a course, that's
Yeah.
actually been really enabling, because then they're together and you get this great cross pollination. I'm not suggesting that that's like the panacea that all that ails us, but
Yeah.
I'll share with you, like I'm a step parent, and that was an awakening of what influence looks like and
Yeah.
patience. And I'll make my stepkids listen to this, but I'm grateful for that education, because understanding not only what it's like to be a parent, but also to be 1 degree removed from that, that it's a gift. And again, I
Yeah.
think the challenge is we don't often have the time or the capacity to do that.
Yeah, yeah, yeah. And I think too that we have to look at what our similarities are. What do we all have in common and start there? So, you
That's
know,
right.
some surveys that we have done at Maxwell Management Group show that regardless of age, really everyone wants to be trusted and respected and to make a meaningful difference, right?
That's
That their
right.
work is meaningful. Really, everyone feels that way. And I think that's where we have to start is more so than what are our differences, what are our commonalities, right? And start from there. How can we all make a difference and have a purposeful work and purposeful career?
Yeah, that's right. No one sets out to say, given the choice of options, I prefer to do a poor job, or
Yeah.
I prefer to underperform, or I prefer to be tone deaf.
Yeah.
And I think that it's creating that, again, that collective liberation. How do we create places and spaces so that people can share?
Yeah.
One of the things we talk about quite a lot at the college is it's not just about content; it's about context. What's the
Yeah.
context that we're actually offering this in? So if we're running a leads-based course within a large multi-site teaching hospital, that is materially different than running that same course in a small community-based organization. Those are two different
Mhm.
things. And we need to, or if we're dealing with, an urban center versus, for an indigenous population, or a population of newcomers, like, we have to adjust for the context. And it's,
Mhm.
again, creating those places and spaces where we can share information about that context so that we can
Mhm.
understand what those differences are.
Mhm. It's so true. That is so true. And so, do you believe then, Sue, that we are adequately preparing emerging leaders, or are we still promoting faster than we are developing?
Yeah, I don't really have an answer to that. What I can do is reflect back what I'm hearing, and what I've heard in the last 18 months is that COVID was the great accelerator. You heard about these, like, wartime commissions where someone was a manager and they're um, performing well, or able to thrive, and we promote them to director, and promote them to VP or something like that.
Yeah.
When maybe they really weren't prepared for that. I don't have that personal experience, so I don't know. But again, I'm sort of reflecting what I've heard. It's always been one of the challenges within healthcare is that if someone is very good on the bench or at the bedside, that doesn't necessarily make them a great leader. And nor
Yeah.
should they be a great leader. And I think, I worked on University Avenue in the early stages of my career. And the inertia was really around, how do I get from director to VP to senior VP, and how do I have more? And the reality is, it goes back to what I was talking about, self-reflection. Maybe people aren't, like, does that bring you joy at work? Are you actually going to be joyful if you're COO or CEO or EVP? Only individuals can answer that question. But I think that um, being having that self-reflection, understanding what gives you joy,
Yeah.
is really important. And then when you
Mhm.
combine that with organizations that invest in leadership development,
Yes.
and making sure that there are milestones that people need, quote unquote, need to achieve in order for promotion, and that they're ready to bring their best selves.
Mhm.
I think it's important because if you think about it, you know, the right the right role and the right environment liberates us to bring their best selves.
Yes. Yeah.
And again, it all comes back to sort of, do we have time to actually pause and plan and make sure that we're, hitting the right milestones? Like
Yeah.
I'm fortunate. I only have 25 people. So I know everybody personally. We can do a
Yeah.
strategic human resources. I can wrap my arms around it. Some of the CEOs across they have 10, 12, 20,000 people,
Yes.
in their shops. And, like, how do you actually do that at scale? I think is really, really challenging when, you're running burn units and trauma units and research institutes, and, you're teaching
Mhm.
hospitals. Like, those are very, very challenging things.
Mhm. So complex, right? Much more complexity. Um, so, if you could give one piece of advice to every healthcare leader in Canada, Sue, right now, regardless of title, what would it be?
Well, you were on our show, Heather, and you said like lead from where you are. I think it's worth echoing that for sure. Um, and then I think that leadership is really a journey. It's not a destination, and I think that journey requires communities in order to
Yeah.
bear the weight of that. Like, I'll use a swimming example. People think that swimming is an individual sport, and you're in the pool 4 hours a day. You're staring at the bottom of a pool. You're swimming 10, 12, 14 kilometers a day. And yes, it is individual, but the nuance there is you're doing it with 30 or 40 other people. And
Mhm.
so that you're there with other people to sort of carry the weight of that training. Healthcare is very much like that too. Like, yes, it is individual. Yes, I'm at the bedside, or yes, I'm leading a meeting, but you have others to bolster the weight of that. And I think that creating that communities of practice is really critically important, making
Yeah.
those investments in leadership development. And
Yes.
I would hope that my dream scene is that the college is the go-to place for leadership development, so that we are able to evolve what we're doing in a way that's like, yes, I'm only going to the college. That's my community, because that meets most of my needs.
Yep, that ongoing professional development is so important. So, finally, Sue, what gives you hope right now?
Oh, it's the people. Like, honestly, the people are amazing.
Hmm.
There's like, I'm so blessed in my role that I get to meet people from across the country that are like ready, willing, and able to give their time. I was up in Yellowknife last year. The elders made bannock for our one of our meetings.
Oh,
There's so much
wow.
bannock we couldn't eat it all, but it was like the beauty of
Wow.
that was overwhelming. Or, again, when I work in hospitals, where the people that I meet that the at all different levels, that are so welcoming and so amazing. And there are some fantastic leaders across the country that
Yes.
the general public doesn't know how hard it is to be a healthcare leader, or how complicated it is. And we have some amazing people. And I'm grateful that these leaders, take my calls, and they participate in college events, because that's something that enriches not only my life, but hopefully the work of the college as a whole.
Yes, absolutely. That is so important. I love what we spoke about. I think we hit a lot of high points here. And certainly it really is all about people in healthcare. There's no doubt about it. It
Hmm.
really is all about people. And it's about creating a safe workplace for them and ensuring that, they're happy in their roles, they're engaged. There is some training and professional development, ongoing professional development that they can tap into, right? And that so that they feel valued and respected, because obviously this is such an important. I just feel like healthcare is. It doesn't matter what role you have; every role is equally important,
That's right.
um, right? It's just so critical, and wow, like we talked about AI, we talked about the technology that's coming down the pipes. Really, like everyone in our sector, to your point, nobody, I don't think, gets into this sector thinking, I'm getting into this to make $1 million or something like that a year. Everyone in this field is showing extraordinary commitment, and
Hmm.
everyone wants to do a good job, right? For obviously, for the best quality care, whether you have residents or patients, whatever your organization looks like. But thank you for joining us, Sue. And are there any other um, I don't know. Are there any other key points, or what would you like people to think about in closing?
Well, just in closing, I thank you for being on your show, and having the chance to discuss all things healthcare, because it certainly satisfies the intellectual part of my brain. But, there's going to be a lot of people listening to this. And, we all make a difference. In the last 18 months, I wouldn't be able to discharge my role without the generosity of people, of their time and advice from
Yeah.
across the country. And I hope my goal is to pay that forward, because I certainly can't thank people enough. And I think I would just, in closing, that is a generous gift. Give the gift of your time and feedback to each other, because it is a team sport, and we do need to create communities and embody this notion of together we get better.
Yes. Yes. I love that, Sue. That was a great way to sum it up. So thank you again for being on our podcast. It is always so wonderful to see you, and you're just a wealth of knowledge. And thank you for all that you do at the college, and, for all of the support that the college provides health leaders across Canada. It's amazing. So thank you so much for being with us. And as we wrap up this conversation, one thing is clear. Leadership will continue to be one of the most critical factors in shaping the future of healthcare in Canada. These are complex challenges that we've discussed, but they are also opportunities for stronger alignment, for intentional leadership, and a renewed focus on people, culture, and purpose. To our listeners, thank you for being part of this conversation and for the role you play in moving the mission forward in your own organizations and communities. And to our guest, Sue Owen, thank you for your leadership, Sue, your insight, and for contributing to such an important dialogue. This has been Mission in Motion, a Minute with Maxwell, where we connect people, purpose, and possibility. So thank you for joining us today. Please feel free to visit our website at maxwellmanagementgroup.com. And also, please like and subscribe to our podcast wherever you download podcasts. Thank you for joining, and see you next time.